be grateful if you could take your seats, please. And now, well, we're moving towards the end of the day and into our panel discussion session. So this is where our panel members will explore some key questions and then take some questions from the floor if anybody would like to ask them anything. So first of all, I'd like to welcome our panel members. So we've got Ancha and John, who you've already met today. But also joining us on the panel, we have Neil Munslow, who is the Service Manager for Active Inclusion at Newcastle City Council, and Suzanne Halliwell, Head of Care and Support at 13 Group. So I'm going to hand the mic down the line so that they can, Neil and Suzanne can introduce themselves in a little more detail.
Thank you. So I'm Neil Munslow. So I haven't got the focal length, can't really see anybody or the mic right, but I'm Service Manager for what we call Active Inclusion at Newcastle, which is about trying to create the conditions, or the foundations probably. I think today I'm thinking it's much more about foundations for a stable life, somewhere to live and income, financial inclusion and employment opportunities. And we don't necessarily succeed in all those things, but I think it's important to have an aspiration, despite the difficult financial context that we all work in. So that's my role. It's a directly delivered team. We provide something like, I think, around 30,000 contacts. We're providing advice, vertical write down, so we remember the numbers that give you a sense of that foundation. And I think often what we do is quite functional. It is providing advice. So in the last year, through our partnership work and direct delivery, nearly 4,569 cases of homelessness prevented, 1,363 people accommodated, over £20 million of benefits gained. But I think the thing I've picked up today is that functional really needs to align with the relational, and I think that's what came across ever so strongly, that it isn't a one-size-fits-all type approach. And what Ancha and Claire and Rachel do is connect with people that we haven't connected with in other ways. And I think it's so important that we do align together. And in terms of passion, they could, if I say tune tune, do I not get a black and white harmony? Where am I? That's shocking.
There's no point in discussing that with me because I'm a Huddersfield Town supporter and we're absolutely rubbish. So my name is Suzanne Halliwell, and my current role is that I'm a Head of Care and Support at 13 Group, and for those of you that have not heard of us, we're a housing association. We've got about 36,000 properties, predominantly across the Tees Valley. So I asked the question about what your passion was. So as you can probably tell, I'm not originally from Newcastle, and I moved up here when I was about 22, and came from a relatively small town. So a lot of people today have talked about relationships and loneliness, and I think that's really quite important when we talk about place-based approaches to tackling poverty and bringing communities together, because actually my experience of moving up to Newcastle was I did feel quite lonely, and when I moved to Whitley Bay and I started having children and I didn't really know any other parents, actually making that approach to other parents and getting to know them in the local area. So my passion sort of inadvertently became about how do we create connection. So I ended up getting involved in an organisation called Whitley Bay Big Local, which is also a national lottery funded project, a 10-year project, basically giving £1 million to a local community and then just letting them decide how that will be spent. So it's dictated by and involves the local community. And I think that taught me a lot about you can't parachute in, big government or even local authority levels don't often know the answers to the solutions of the problems in that community. It is the community that know what the problems are, and the solutions will come from those communities, not from big state. If we wait for the government to come in and solve our problems, it ain't ever going to happen. I honestly believe that, right? So the solutions start here in local communities of 2,000-3,000 population. So that's a bit of my passion.
Great, thank you very much. So, if I may, I'd like to direct the first question to John and Ancha. And it's, do we have any evidence of how we can make system change happen?
I think we've heard quite a lot today in terms of the involvement of the community, and the involvement of the community can really help that system change in itself. So empowering the community to be more involved within their own lives, within the lives of other people that they come across, and I think that in itself is part of the system change. I think in terms of other organisations that we work alongside in partnership with as well, I know John earlier alluded to some of the challenges that happen around that when other services are working in their silos with their own targets, KPIs, and then we're working within a system where we're trying to remove that can become really challenging. But I think there are ways around that as well of involving those organisations within like our one-stop shop, for example, where those organisations can still work together alongside us, alongside that holistic conversation that we have, but also still do their own work. So for example, Emma, who's still here today from Your Homes Newcastle, who's involved in our one-stop shop, the volunteers and Claire and myself will still do the holistic conversation with a person when they first come in. But if their needs are very much around their financial situation and they're Your Homes Newcastle tenant, then we will introduce straight away to Emma there. So I think that's that way that system change can happen, but it is challenging. It is.
I think we talked quite a lot about system change in the kind of lifting it together. So I'm going to take a bit more kind of esoteric as a question. So I think there's particularly around system change, it's about us moving towards more early intervention prevention across all of our public service delivery and all of our third sector delivery. I feel like we've got to pay attention to the fact that it takes capacity and thought and a lot of effort. Like having a learning organisation approach takes an enormous amount of time and effort, and it's often in the background or you maybe don't notice it as much. It's the sort of thing that disappears when, like in COVID, we all work from home. It's the sort of thing that maybe around a table today you experience, but it's because you bothered to take some time out of your week to come to something where you'd see people in real life and chat about something which isn't your immediate goal. So I think recognising that it's an investment and it requires capacity, and when we're burned out just trying to run as fast as we can just to stay on the same spot, it just doesn't happen. Consistent change absolutely doesn't happen. But it does require the buy-in from the top, and often from the top we hear people saying, absolutely, we need that system change to happen. But it needs buy-in from the top, but it then needs work at every layer, all the way down. One of the bits that Ian's really helpfully pointed out this year is that I hadn't been responding enough to our own team's need, to our visioning at a quite low level. We actually experience, modest turnover in teams like this. At any frontline organisation, you experience people who get promoted into other roles, who go into work in a different place. A new project comes and it's really exciting, and we jump into that because there's more available. So we've got to have a constant cycle of visioning. So it needs to be that there's a sort of strategic point, that the middle managers are out of the way, and there's constant visioning at the bottom line. And the other thing I want to say about system change, and I'll just keep really brief, is everyone needs to get out of each other's way a wee bit. Like just quite often when we're collecting data about something, for instance, and this is just one example, or where we're putting out a procurement process of some sort, we assume we need to do something because that's what everyone else does, and we don't think, okay, so if this person in front of me doesn't tick the box that says, they are a UK national, so what am I going to do different? Like, why am I collecting this data? What's the actual advantage to me collecting this? And I think if we get out of each other's way a little bit, by not presuming that other people want this data, or other people have the answers. I think that can often help as well. So just making things simpler for each other within the sector.
Thanks, John and Ancha. Second question for the panel is more, I think, directed towards Suzanne and Neil. What role do you believe community anchor organisations, such as housing providers, have in making that system change happen?
We've worked together for quite a long time, so sort of familiar with this. I think the idea of the system is quite nebulous. I'm not quite sure whose system we're talking about, what it is. Is it the economy, well-being, delivering on political decisions? Those things are really difficult. I think what John said about maybe sometimes it's just about simplifying things as much as possible and helping people to live in their communities, and within that, I think it was Rachel said something about being visible, something about listening, something about local accountability, and change your mindset. Particularly if we're thinking about housing providers, it's predominantly a contractual arrangement. People pay rent and they get somewhere to live in return for that rent. And if they stop paying the rent, they get kicked out. But I don't know when that idea started, probably 700 or 800 years ago, and it's a bit out of date. I think it's fairly hard to have any stability in your life without having a stable home, something that goes with it, and it becomes increasingly difficult for people to pay their rent. When in Newcastle, £105 million a year taken from the benefit system. Work isn't the answer. Suzanne, I'll leave that to her. She's got better statistics and knows more about the challenges that low-paid work creates, and rents go up all the time. So one of the things that I think Suzanne and I started working on probably 2007 was having an approach with Your Homes Newcastle of no evictions into homelessness. And finally got it as a policy commitment. We went from, I think it was 197 evictions in 2007 to one last year. We can't force everybody to take the advice and support. This idea of let's not punish people for being poor, let's try and understand, let's try and help people to maximise their income, use forbearance, buy time and help people. But I think it also means connecting and listening through other avenues. I think the films and the talks this morning showed that not everybody's going to respond to the letter. Not everybody's going to respond to that knock on the door. So being open to liaison through community organisations. I'm really glad when Ancha approached us and said, we would like to work with you in the way that we've been working with the food bank, and using that opportunity, I think that together we can do more to offset that. I think on the flip side, I really also liked the alternatives that we give, because the reality is we're probably not going to lift people out of poverty. The scale of poverty is so huge, but we can mitigate the damage. We can create opportunities for people. So I loved the activities that we showed today. The gardening, the sewing, the arts and crafts classes, the sport. Those things people can partake in. Whether or not they're rich or poor, obviously they need funding and they need to keep going, but I think they create a reason to live. I think sometimes just the functional side of it doesn't create a reason to live, so I think that joining up, that having a structured but not rigid relationship together, so where if there's a problem that comes through Building Futures East or the Lifting Neighbourhoods team, that we are responsible and can respond together. We can't always have the answer that people want. I know one of the people that spoke this morning said, been waiting for a long time to be rehoused. And those are structural problems that we've lost, 40% of housing through right to buy. It's a real big challenge creating enough housing, but at least we can be honest together about how long people are waiting and what are those competing demands and try to create those moves. So I'll stop and hand over.
I'm going to come at this from a slightly different approach. So not all housing providers are the same. I'm going to start with that. There's a massive private rented sector. Over 4 million people live in the private rented sector. And so, dare I say it, I'm going to turn my head on what I've just previously said, which is don't wait for the government to come in and save the world. But actually we're all waiting for regulation to come into the private rented sector to improve it. And I think that's really important. I think without that legislation, unfortunately there are going to be people that continue to live in quite poor private rented accommodation. And not all housing association council housing providers are the same. So although lots of people make choices to come into council housing and housing association, lots of people don't. Sometimes it's, I've gone into council housing and I've done it myself. I've gone into a council flat, it's what I could afford at the time, you know, it was an affordable rent, and that's great, but just because that wasn't necessarily my first choice doesn't mean to say that that product shouldn't be really good. So what I mean is, like, actually when I move in, are the walls decorated? Because if they're not, I'm going to spend a fortune on decorating it. Do I have that money to do it? So then I can't do it for 2 or 3 years, so I'm living in an undecorated house. Is the carpets when I move in? Carpets are probably one of the most expensive things, you know, as a single purchase. It's probably, if you were putting decent carpet in a 3-bedroom house, it's probably going to cost you £1,000. Who has got £1,000 hanging around? Don't know many people that have got that. So actually, there are some basics that housing providers probably should get better and do right by. You know, so if we're talking about poverty, actually those 2 things alone could make a big difference. So I do think that housing providers need to think more carefully about, you know, we pay, as tenants, we pay rent. Actually, we're deserving of a good service then, aren't we? And it should start with that. The other thing that I think good housing providers do is they don't just see themselves as the providers of bricks and mortar. They do see that they are part of the community and there are other services that they can deliver. So the housing organisation I work for now and the previous one that I worked for, you know, did take the time to deliver benefit and debt advice, did take the time to deliver employability services, did take the time to say, actually, evicting people is probably the wrong thing to do, even if they're in financial distress. Actually, we should always try to make the effort. Eviction is an absolute failure, and we should always try to work towards keeping people in the homes. And those things about social justice, if you're coming from the right place and you really believe that, that can really make a difference in that local community.
Thanks very much, Neil and Suzanne. The third question, which is one really sort of more towards Ancha and John, is what are the key components you consider essential when thinking about the creation of effective, sustainable community assets?
Let me get my thoughts in order a little bit. I suppose community assets, I'll not ask you this as an actual question, but to me there's 3 kind of community assets that jump out as a starter. So there's things that are physical assets, like treetops as a building, we'll talk about parks, we talk about community centres, things like that. I think there's a well-established understanding that those are really important in every community, and particularly in private communities, we need to be investing in those places. There's then the community assets, which are the people, and actually a huge amount of organisations' job is going around finding community assets who are behind doors, who are doing wonderful things, and we've heard from several examples today, but where they know and they can bring more in that community than any professional can. And so I think there's just an unbelievable amount of work needs to be done for that. But there's no one who knows better how to transform their own communities, how to transform their own lives on the local ground than people who live there. So the idea that we invest in parks and community centres is great, but do we invest as much at the moment in finding the people who can be assets in the community? Or when we do find them, we tend to treat them as patients or service users or something awful like that, rather than say, this is someone where, yeah, I could support them, but they can then go on and flourish and they can be the asset themselves. And I think the third kind of community asset that exists is organisations that are community development trusts, it's not all anchor organisations in other ways, where it's not that some great sprawling infrastructure of many, many staff need to be there. But I think there's lots of common consensus come out of all sorts of programmes. I look at the Our Place programme in Scotland, I look at the big local stuff down here, look at the children's communities work in Scotland and in England and indeed in America. Look at the work that Cora Foundation is doing in communities in Scotland. There's a pattern where a very small amount of coordinating resource in the communities that most need it can unlock those local community assets. They can make it so a community centre actually does useful things rather than just kind of be stuck just trying to keep its own doors open. And I think investing in those organisations, this is the pitch for us, by the way, we're a slightly different kind of organisation, investing in those organisations so they can keep their doors open and, dare I say, even to have that capacity to do the system change, which just requires a wee bit more unrestricted, I think is a big bit that we often miss. So I think those two other types of community assets are often overlooked.
I'll not repeat what John's said there, but just to touch more on, I guess, the people side of community assets. And I think what we've found as well in terms of the Walker area is that we've engaged with, thinking about the tower blocks I talked about earlier, we've engaged with a few residents living in the tower blocks who then, because of what they've, the way that they've received support, have then become what we would call kind of a community connector. And because of those people living within the tower blocks, they've then brought other people to us. So I think in terms of making sure that we're really supporting those people who are then become the community connectors to then also spread the word throughout the community and bring more people in, so that really does kind of provide that sustainable support within the community as well.
Thank you so much, yeah. Some really interesting thoughts there. Now, I'm just conscious of time, so I wonder whether we can go to the floor now to see if anybody's got any questions they'd like to ask our panel. Laura's coming round with the rolling mic.
This is for, is this on? Yeah, this is for Neil. When you say there's going to be there's no evictions through Newcastle, is that just for people who are in rent arrears or financial difficulties? Because we've got a very few, but nevertheless there's a few people who live in Walker who are causing absolute mayhem, have done so for numerous years, and are never ever evicted. Instead, the people surrounding them have to move, or like, so you're leaving the problem there. You're not, if you're not evicting people for really disgraceful behaviour and criminal behaviour.
What we say is no evictions into homelessness, which is slightly different to having no evictions. So it's finding an alternative for those people, because that small number that cause hell for everybody who lives around is a real challenge. But if their behaviour isn't addressed and they're just moved, their health for somebody else, sometimes that is what's needed. And those people can and still should be moved. It's the no evictions into homelessness, but it's dealing with the behaviour is the real challenge. And with antisocial behaviour, and I've heard some of the stories of some of those households in Walker. I think there are, that comes back to what is the system? What's the role of the police? One of the cases that I became a little bit involved with, there was a question about who gathers evidence, and the local people were quite frightened to gather evidence. The police didn't want to invest in cameras and other means of gathering evidence, because that becomes, I think, beyond the role of a housing provider. That is something that the police should be involved in when the level of criminality is so high. Is that, I mean, it's a vague answer, but it's the best you'll get.
I just wonder whether it's possible to, to lift neighbourhoods out of poverty without primarily, as a top line, addressing the inequalities issues. And I don't think, unless I missed it, and apologise for that, but nothing has been mentioned today, which worries me, from the organising group, that Northumberland, a Conservative authority, as you know, has just developed an inequalities strategy and really aims to become what's called a Marmot authority. So if you know Michael Marmot and the kind of things that he came up with seems actually quite significant. And coming up quite soon, then Vaughan, for voluntary organisations, is actually introducing its inequalities strategy as the top line of what factors will shape that. So pretty concerned that has been rather weak, from the front, and how you would think we can move on from here today with inequalities at the top line. And I think it was Michael Marmot 10 years ago said to us in Durham, face to face, that we've got to recognise that people are living in toxic systems. And that's to quote Michael Marmot, people are living in toxic systems. And in some senses, how do we get rid of that toxicity? You know what I mean? Taking up the jargon of the thing. So inequalities is one way. And I think north of the border, there are some moves to make that possible. You recognise my accent, but it doesn't feature strong here. And the danger of organisations is that they enjoy the wealth coming from the centre to address the symptoms, and not actually use wealth to address community wealth type of things. And Building Futures East has worked hard at that in some ways and challenged the system here. But as we move towards a regional assembly again after a number of years, then it's a big moment for people like here today saying, when can we start discussing what the inclusion strategy will be for the new regional authority? And we've seen a lot of undercurrents, with Jamie Driscoll and these things, that there are voices who don't want that to happen. So I'm just challenging. What about inequalities at the top line?
I'll just say, I think other people on the panel will be much better talk about their local implications in the northeast. You made loads of good points there. Two things. One, in Scotland, we're often looked at as being like, we've got better policies around health equity. I think that's quite commonly, certainly in Scotland, it's quite commonly phrased. And then it tends to be followed by someone saying, but the implementation hasn't actually closed the gap. And it tends to be what people say. But one thing I would like the Northeast to realise as it develops a number of strategies around health inequalities, health equity, putting inclusion at the top of the agenda, is a policy where the implementation doesn't happen is just a failed policy. It's not the implementation's fault. It's not because, all those, just all those damn offices we funded, they're all rubbish, aren't they? It's not that at all. It's that the policy was wrong. And so I think there's lessons from Scotland in being like, you can talk the talk, but your policy's bad if the implementation doesn't follow. So I encourage people to learn from that. The other thing, we call this lifting neighbours out of poverty, and during COVID and then a cost of living crisis and swinging cuts to people's income, as well as big inflation, obviously, they're two different things. Reduction in ability of third sector and public sector provision because of budget cuts. I think it all feels a little bit hopeless. I feel like if I took a wee poll just now, do people feel good about the world or bad about the world, and do we feel like poverty can be addressed without some massive systemic, unbelievable systemic change, not even things in the gift of Westminster? People are pretty hopeless. I think it's important we keep a vision that does say, I honestly believe that the sorts of neighbourhoods we're talking about can be lifted out of poverty. And I honestly believe that even though it doesn't happen as often as it can, speaking of Renewal, people do lift themselves out of poverty and are sometimes assisted and have transformative results. And if we don't keep in mind that that's possible, how are we meant to inspire people to go through that process themselves? Because one of the things we see a lot this year is people say, well, I've heard that as many people are in poverty in work. Why would I bother to work in that situation? If you see what I mean. But if you don't go on that journey, most people do get stuck, unfortunately, in poverty, in work poverty. But the only way into in-work non-poverty is to go through the journey, if you see what I mean. So I feel like the sense of hopelessness can be albatross around our neck. Ooh, that's a mixed metaphor. An albatross So I think we sometimes talk about hopeful things. So today's conference we call that on the basis of trying to say, I honestly believe it's possible. It's not happening. It's not happening enough, but it's possible. But we need to own the sense that that vision is possible. Sorry.
Okay, strategy. I kind of agree with some of John's comments. Strategy has got to be lived. You know, it's got to come down to action and doing stuff. So for those who know me a little bit in the room, I always used to get quite frustrated because I'd like people to talk about a 5-year housing strategy or the strategic vision, and it's like, well, I just want to get on and do some stuff that's good, that's actually going to make a difference. So for me, I live in quite practicality. So one of the things that I do believe is, yes, I mean, it'd be great if the funding formula for local authorities, particularly in the North East, was fairer than what it is. But the reality is it isn't. So some of the things that is in our gift is circular economies. And I'll give you an example of a good circular economy argument. So who we are, and I'll give a conflict of interest declaration here. I sit on the board of directors of a credit union. Does anybody here know what a credit union is? Who was a member? So there's a few people, right, okay. So, if you take a loan out with a bank, right, unless it's a building society, right, that loan interest, the profit, goes straight directly out to shareholders, some of them offshore, they don't even live in the country, right? If you take a loan out with a credit union, it's owned by the members, that money is reinvested back into that local community. So some of this is in our gift, right? Where do we choose to shop? Where do we choose to get loans? When investments made within a local area, do we keep it in the local area so that that money is recirculated? A good example of that, and it's something I've challenged my own organisation on, is, okay, so housing organisations earn money off the rents of tenants, right? That's how they earn money, right? That's the business model. But how many of our own tenants do we actually employ? Right, so when we talk about circular economies, and you know that money is getting reinvested into people and employing them, and they live in our properties. That's a really good example. So I'd like to see more of the doing and a little bit. Yeah, strategy's great, but it's only any good if it's lived and not on a bookshelf, which quite often a lot of strategies stay there. That's where they stay. They never get put into action.
We've probably got 2 minutes for, I think, the lady over there with the hand up. Before we move on.
Hi, yes, mine fits in nicely with your question and your answer, really. So my charity, Support Grow North East, we work across 2 councils, Northumberland and North Tyneside. One is Labour and one is Conservative, so just so everybody knows, I don't care what colour rosette you wear. I just want to comment that I think it's obvious to me that because a lot of the fabulous work you guys are doing, we do slightly differently but similar in Support and Grow, so we definitely need to have a conversation. But it occurs to me, and I've said this often in my presentations, about how we continually mop up the flood without turning off the tap. I just want you to hold that thought. I'm going to come back to that with my question. But just in response to your question, which was useful, I think, I want to make the point that health inequalities and poverty are absolutely interlinked. So we can't talk about poverty without talking about health inequalities, and I think although you haven't stated it, you've displayed it, because every single person that's spoken has had those health inequalities, and health inequalities is not being able to access, for whatever reason, what other people can access. On the point of strategy, I just want to say that I am aware of Northumberland Council's strategies and North Tyneside Council's strategies, and I'm part of the Poverty Truth Commission for the North of Tyne, and I'm on the North Tyneside Council Poverty Prevention Network and every other network that you can be involved in. So I'm very aware of everybody's strategy. And just reinforcing the point you guys made is that strategies are made usually, with all due respect, by white men in boardrooms and don't have the voices of the people in our communities, and there's a huge disconnect between strategy and implementation, and that's why it fails. And I just want to ask yourselves that I absolutely understand, and I'm right behind you, that we too operate in a system that we've created, a collaborative working model that we've created in our communities and throughout our communities. But unless the strategy matches that, it is really hard. It creates a barrier in itself. So the question I want to ask is, what do you feel, or how do you feel we can change that? So back to that, turning up the tap instead of mopping up the flood. How do you feel we can make sure that these strategies have our voices around that table?
So in terms of time, panel, I think we've only got time for sort of probably a minute from one of you. I don't know who wants to pick up on that.
I think we just need to keep pushing. I mean, we've had conversations, obviously what she on here from Public Health, we've had conversations about how we can feed into sort of anti-poverty strategies going forward, how we can feed community members into that, how we can have focus groups, I hate the word focus groups, but you know what I'm trying to get at, with community members and having their voice inputting into everything, whether that is research, whether that is strategy, and we just need to keep pushing it. And keep asking the questions and keep, being passionate about that.
I thought it was a great question, but I'm going to give other people the floor.
Yeah, I was feeling the pressure of that one. In terms of living it. Okay, so I think part of the issue is that strategies are written in a room with, a lot of white males from a very academic background, and quite often they're not based in the reality of the communities in which they're supposed to purport to serve. And I think they've got to start by, some of the strategies assume that they know the answers, and that's part of the problem, that they're asking the right question in the first place. So I think you've got to go back to the community, really find out what the real issues are from their point of view, not because you want to achieve a certain set of goals. And that informs the strategy, but then it's got to go back down to action again. It's got to go back to the action. So for me, that's I know you've got to keep informing it, but when people talk about Whitehall, it does feel very distant, doesn't it? I do sometimes wonder, like a North East strategy, has anybody actually even been to Newcastle when they've written it? Question mark.
Sorry. You stopped at that, haven't you? Just decided you remember. I thought, picking up on the first question, it was positive today that people, the vibe seemed to be, what are we going to do in Walker, not, what am I going to do in Walker, not what am I going to do if I'm Prime Minister, which is very unlikely, although who knows, there seems to be quite changeable, doesn't it, that, in that focus on what we can do locally and being locally accountable, I think picking up those points, being visible, listening, I think reviewing together all the 5-year strategies that I've been involved in, none of them predicted COVID, none of them predicted the economic downturn. We have to do things more in real time, and I think finally we have to aggregate from the individual rather than the other way around. We have to start with the person and build up, not build down.
Great, thank you very much, everybody. Right, I'd just like to thank the panellists for your time and your sort of insight in terms of answering those questions. I'm sure you'll agree it was quite a stimulating discussion, and there will be opportunity once we've concluded, I'm sure, for any sort of individual conversations. So, panellists, if you would like to...